Hello, everyone. Welcome to our ClearStep Financial webinars this evening. ClearStep has offices. We have 6 offices, locations, and we cover licenses in most states of the United States. Our advisors focus on education and teaching about money and finance, so we're very thankful about that. We bring today 2 important issues and topics, Social Security and Medicare, and we are going to start with Medicare first. So Nikki Johnson is a specialist in the Wisconsin area here with FHK Insurance, and most of the information she is going to give tonight pertains to people in just about every state. So this will be great information. Top speaker. Thanks, Nikki. You're on.
No problem. Thanks so much for having me tonight. I'm very excited to help you all navigate that Medicare maze. So we'll go ahead and get the presentation pulled up. And let's see. All right. Are we all able to see that screen from the beginning? Understanding Medicare, the most confusing topic in the world. So I'm a broker with FHK Insurance. FHK is located in Glendale, Wisconsin, but we do serve beneficiaries all throughout the United States. So we are currently licensed in 33 different states. It's a lot to navigate with health insurance. Our specialty area is Medicare. We are licensed and contracted with the majority of the providers that are out there, but for more in-depth analysis, feel free to reach out and use me as a resource. For the next 30 minutes, we will be talking about the history of Medicare, the different parts of Medicare, what I like to call the Medicare alphabet, Medicare eligibility and enrollment periods, the choices and costs, if you should even enroll in Medicare, and then a little look at the Medicare options that are available. So Medicare began in 1965, and when it first started, it was very basic. It just included coverage for inpatient hospitalization stays, and then also doctor services and outpatient services. In the 70s, it was expanded to include individuals with certain disabilities, and then in the early 2000s, the Medicare Advantage and prescription drug plans came about. And that's really what is going to be changing a lot in 2025. So we have some really exciting information to share when it comes to the Medicare changes. When we look at just basic Medicare, Part A is what I like to refer to as premium-free health insurance. So as long as you worked 40 quarters, which equates to about 10 years, you will qualify for premium-free Part A. This is going to cover your inpatient hospitalization services, as well as things like hospice care and skilled nursing that is going to be in a hospital setting. Now, one thing that's unique with Medicare Part A is that it does have a deductible. And for 2024, that deductible is $1,632. You'll notice it says per benefit period. Medicare sees a benefit period as every 60 days. So unless you have some kind of plan to kind of fill in that gaps, it could be a very expensive out-of-pocket cost if you incur inpatient hospitalizations. If you're currently working and contributing to an HSA, you do want to pay attention to the timelines of when to enroll in Medicare and how to enroll in Medicare. Medicare Part B is going to cover your outpatient doctor services, along with things like durable medical equipment, so wheelchairs, walkers, CPAP supplies, outpatient testing, things like diagnostic coverage. So there's a lot that goes into Medicare Part B. Unlike Medicare Part A being premium free, Medicare Part B does have a premium that's associated with it. When you are looking at Medicare Part B, you are going to have an annual deductible. So that's a little different from the Medicare Part A deductible, but that annual deductible for 2024 is $240. Once you have reached that, you are essentially covered depending on what type of plan you're on. Outpatient services and co-insurance is usually 20%. So you do want to make sure that you have something to kind of fill in the gaps to eliminate the out-of-pocket cost. Now, when you are enrolling in Medicare, Social Security and Medicare are going to look back at your income from 2 years ago. So Medicare is always going to be 2 years behind. If you enroll in Medicare in 2024, they are going to look at your modified adjusted gross income from your tax return from 2022, and that's how Medicare is going to assess what your Part B premium is going to be, along with your Part D premium. Now, most individuals will fall into that top tier category where they will just have the base premium of $174.70, But there are situations where you might have had a higher income year. In that situation, if your income is a little bit higher, you will be assessed with what's called an IRMA, or an income-related monthly adjustment amount. Essentially, that means that you will pay more for your Part B premium as well as your Part D premium. But not to worry, if you do have a higher income year, you are able to appeal that IRMA through Social Security. So for 2025, they have not released the premiums just quite yet, but they are anticipating a slight increase on the Part B premium. From what I've seen in years past, it usually goes up about $10, but until those numbers drop on October 1st, I can't say for certain that it is going to increase by that amount, but just keep an eye out for those upcoming changes. When you are looking at Medicare as a total alphabet, Parts A and Part B will be administered by the federal government. So that can happen automatically when you turn 65 if you're collecting Social Security. That might also happen if you're under 65 and you're collecting Social Security disability. Part C and Part D are going to be administered by private insurance companies. So Part C is going to refer to Medicare Advantage plans, which are going to include Parts A and B, and then also coverage for prescription drugs. Prescription drug coverage, also known as Part D, can be purchased as a standalone option if you are looking at a Medicare supplemental plan or a Medigap option. It might also be embedded in a Medicare Advantage plan. So there's a lot of ways to get covered for your prescriptions and also your Medicare needs. When you're looking at those eligibility and enrollment timelines, it's important to know who's eligible to receive Medicare. Well, if you're a U.S. citizen 65 and over, you will qualify for Medicare. If you are under 65, but you've been collecting Social Security disability for 24 months, on that 25th month, you are automatically going to be enrolled in Medicare. If you have certain disabilities like end-stage renal disease or ALS, you will also be granted access into Medicare. Now, if you are collecting Social Security, that Medicare card is going to arrive automatically when you get close to your initial enrollment period, or IEP. In the insurance world, we absolutely love acronyms, so there is an acronym for almost anything. But I'd have to say the initial enrollment period, or IEP, is the most important Medicare timeline that you do want to pay attention to. So approximately 3 months before the month of your 65th birthday, you will have the option to start exploring what those Medicare plans look like. Now, if you are planning on holding off on Social Security until full retirement age or another date, you can still apply for Medicare benefits only without activating your Social Security, and that can be done 3 months before the month of your 65th birthday. Typically, your Medicare plan will kick off the month that you turn 65, but just in case something happens and you miss that date, you also have 3 months after that to enroll in a plan. Sometimes individuals might activate just certain portions of Medicare and not all the benefits of Medicare. When you are looking at your initial enrollment period, I do encourage everyone to create an SSA.gov account so that you can make that application into Medicare very seamless. If you're collecting Social Security, though, nothing you'll have to do. You will automatically be enrolled. But I have noticed in the past few years, more and more individuals are holding off on their Social Security until that full retirement age. So you will want to enroll either online, over the phone with Social Security, or by visiting your local office. Special enrollment periods are situation dependent. The most popular one that I typically run into is someone that is thinking about retirement or coming off of that employer-sponsored plan. Now, if you are on an employer-sponsored plan and you don't have an HSA, you can go ahead and enroll in Part A to coordinate benefits. But if you do have an HSA, you might want to postpone enrollment into Medicare entirely. Now, the good thing is when you are looking at these Medicare plans, you don't necessarily have to worry about a late enrollment penalty or anything that you might hear about with Part B or Part D if you do have that creditable coverage from your employer. So Medicare sees it as long as you have more than 20 active employees, that counts as creditable coverage. So you can continue to stay on that group plan without incurring any late enrollment penalties. The late enrollment penalty is going to be 10% of every year that you did not initially sign up for Part B. But remember, if you have that employer-sponsored plan or you enroll during your initial enrollment period, turning 65, you won't see that late enrollment penalty. Now, prescription coverage will work pretty similar to that as well. So if you do have an employer-sponsored plan, that coverage is typically going to be as good or better than what Medicare would have to offer, and Medicare would say that that is considered creditable coverage, also eliminating that late enrollment penalty. One thing to keep in mind, though, when you are getting close to 65, looking at the type of plan that you have for your employer is very important. So Medicare will not let you contribute to an HSA if you have any part of Medicare in place. Good news is you can still use the funds that you have in your HSA to help pay for things like premiums on prescription plans or Medicare Advantage plan premium. You can also use those funds for copays and coinsurance. So the good news is you do have a savings account with a chunk of money that you can use for your Medicare out-of-pocket costs, but you do want to make sure that if you are approaching that magic age of 65 and you're on an HSA, you either stop those contributions 6 months before you enroll in Medicare or change your plan entirely when the open enrollment comes through your employer, just to make sure that you coordinate benefits in the great way. Good news is if you're 65 and still working, you have tons of choices and you do not have to make any decision right away. So when people are exploring their plans and costs and coverage, I always recommend that you kind of have a little timeline ready and think about things that pertain to your group plan as long as the Medicare plan's in place. So one thing to think about first and foremost is that monthly premium. Think about how much Medicare costs compared to your employer-sponsored plan. Think about those family members that you might have on that plan and if they would have to have access to coverage. And then also think about the deductibles and coinsurance. So lots of things go into deciding when to enroll in Medicare. Once you have Medicare A and B in place, you are faced with a very exciting decision of what type of plan to enroll in. So your first option is going to be a Medicare supplement plan or a Medigap plan. And that is where Medicare would remain primary. And all of your charges would go to Medicare first, and then the balance would be sent over to your supplemental carrier. This type of insurance plan usually will be offered by a variety of providers and companies, and they will cover everything that Medicare covers. The one thing they don't include, though, is prescription drug coverage. So even if you don't take medications, you still have to have some form of creditable coverage for medications. Otherwise, you'll get that late enrollment penalty. But Medicare supplements are nice because they do travel wherever you go. There's not any network that's out there. So you have the flexibility and freedom to choose the providers and hospital systems that you want to have access to. They are guaranteed renewable as long as you continue to pay your premium, but every year there will be a little bit of a premium increase that might pop up. Now, with the Medicare supplemental plans, as long as Medicare covers something, your supplemental plan will also cover that service. Medicare Advantage or Part C is the other option that you can take a look at. And these types of plans are administered by private insurance companies. So with this plan, you still have Medicare, but it's not going to be the primary biller. What's going to happen is that your insurance company is going to kind of take over, and everything that you do as far as your doctor visits or your inpatient hospital stay or any testing, that's going to go directly to your insurance carrier. And they are going to cover everything that Medicare covers, but sometimes they will have a little bit of extras. You will continue to pay your Part B premium no matter what plan you're on in the Medicare world, but sometimes the Medicare Advantage plans can have low to no monthly premium. So that's what really makes that Medicare choice and kind of prepping for that budget post-retirement important. Majority of the time, you will have access to preventive services. So that's going to include things like your annual wellness exam, mammograms, pap smears, colorectal screenings. Medicare and the Medicare Advantage plans and the Medicare supplements will always cover these procedures for you. You do have what's called a maximum out of pocket. So that kind of acts as your safety net. And all of your copays that you put out throughout the course of the year on the medical side will go towards that maximum out of pocket. Once you hit that max, you are done paying out-of-pocket costs. What makes Medicare Advantage plans unique is the fact that they include extras above and beyond what Medicare covers. So for instance, when you're looking at certain services, you're only going to have access to hospitalization and doctor visits or outpatient services. There's no extra coverage for dental or vision, gym memberships, things like that. But these Advantage plans do have some of those benefits that are built in. The majority of the time, Medicare is going to pay these companies to administer your benefits, and they are going to be cost effective in certain situations, especially if you're not doing a lot of doctoring. But essentially, anything that you have to do in a typical calendar year will be covered by that Medicare Advantage plan as long as it is medically necessary. The Medicare Advantage enrollment period follows the same annual enrollment period as the prescription drugs. So from October 15th until December 7th, that's when you're able to explore all the options that are on the market. Benefits for 2025 officially drop next Tuesday on October 1st. So insurance agents like myself are very excited about that time. We are anticipating a lot of changes on the Medicare prescription drug side. So that is something to think about when you are exploring your Medicare benefits and figuring out what option is going to be the most suitable for you. With prescription drug plans, these officially started in 2006. And it's kind of unique to think that before that, there was nothing to help kind of with the out-of-pocket cost on prescriptions. Now, if you had an employer-sponsored plan or access to the VA, if you were a veteran, you probably had access to some assistance with your prescription coverage. But if you were on Medicare before Part D kicked off in 2006, there was really no assistance to help cover the cost of medications. Every prescription drug plan that's on the market is going to have a list of medications that they refer to as a formulary. And this is what we're anticipating seeing some major changes in 2025. So the Inflation Reduction Act is kicking off January 1st, and that's going to limit Medicare beneficiaries' exposure to out-of-pocket costs, I should say, on the Medicare side, down to $2,000. So if you are someone that takes a lot of expensive medications, maybe you have some tier 3 or tier 4 meds that are very costly now, you should possibly see a reduction in those costs next year once January gets here. But every formulary is going to vary by every company. And then also the copay or out-of-pocket cost is going to vary with that as well. Part D plans do follow the same enrollment timelines as the Medicare Advantage plans. And Medicare supplements, those can be evaluated at any point in time throughout the year. So even if you're happy with your current plan, you still always want to do an annual review just to make sure that you're maximizing those Medicare dollars and that all of your medications and doctors and hospitals are covered. With Medicare Part D plans, they are purchased separately if you have a Medicare supplemental plan. With the majority of the Medicare Advantage plans, you are going to see Medicare prescription drug coverage included. But what will possibly change is the way that those prescriptions are going to be covered. So that's always going to be changing every single year. While Medicare Part D is not required by law to have, it's very, very important to have it so that you do avoid those late enrollment penalties. So I often have a lot of clients that say, Nikki, I'm not taking any medications. I don't know if I necessarily want to pay a premium for something I may or may not use. Depending on what state you reside in, you may have access to different programs that can help cover that prescription drug benefit. Late enrollment penalties are out there on Part B and Part D side. So unfortunately, if you do not make some choices right when you're eligible, you might have that late enrollment penalty on the Part D side. Essentially, if you do not enroll in some kind of standalone prescription plan or a Medicare Advantage plan, or you're not a veteran that has access to the VA, or you don't have access to a state pharmaceutical plan, you may be faced with a late enrollment penalty if you don't enroll within 63 days of Part B being in place. So if you do have Part B in place right now, but you're covered under an employer-sponsored plan, you wouldn't necessarily have any kind of late enrollment penalty for that. But again, everyone's situation is a little different, and health insurance and the prescription drug coverage plans these days are not one size fits all. So it really is individualized to your needs and what works for you. Now, with the prescription drug plans, of course, these formularies are going to change every single year, and how these drugs are classified and categorized are going to change as well. Most of the time when you are looking at a plan's formulary, you're going to see a breakdown of the cost of the medications. So the majority of the formularies that are out there are going to organize their prescriptions into a classification of tiers. Some of them are going to have 6 tiers that are on that plan. Majority of them will have 5 though. So your tier 1 and tier 2 are typically going to be your lowest out-of-pocket medications. think about your maintenance meds. So meds that you might take for certain conditions like diabetes or high blood pressure, cholesterol, things like that. Those medications are typically going to fall into tier 1 and tier 2, being the generic and non-preferred generic, or your lowest out-of-pocket cost. Tiers 3, 4, and 5, that's where you typically have a brand name or maybe a newer medication that's coming on the market. Typically for medications like that, you would have a deductible that you would have to satisfy first. Once that deductible is satisfied, you would either then have a flat copayment or out-of-pocket cost, or you might have a percentage-based copayment. So essentially every single year, these prescription plans and the Medicare Advantage plans are going to be changing their benefits. When you are thinking about changing a Medicare Advantage plan or a prescription drug plan, there are certain timelines that you want to pay attention to as well. If you do like your plan benefits and you've received your annual notice of change, or what we like to call an ANOC in the insurance world, you've evaluated those changes. You said, well, this change might not affect me as much. My company has been working great for me. I'm happy with these changes. I like my plan. Good news, you don't have to do a thing. Your plan will automatically renew every year. However, if you notice that some of those plan benefits might be changing, like your prescription costs might be going up, or a prescription might be eliminated from the formulary or list of drugs, then it's a good time to reevaluate those options. So October 1st is when the 2025 options will drop officially. And then from October 15th until December 7th, that's when the annual enrollment period is happening. And during that time, you can evaluate every plan that is on the market as long as you're in the plan service area. Now, a lot of these plans will travel with you wherever you go. So kind of start thinking about that wish list or things that you might want to see embedded in your plan in the future. Once you've made that plan selection, January 1st will automatically kick off your new plan year. If you find that maybe a prescription wasn't covered or you had a charge that was a little bit higher than you anticipated, you do have a time period called the OEP, or open enrollment period, and that happens from January 1st until March 31st. During that point in time, Medicare beneficiaries are able to move from one Advantage plan to another if they'd like to, or they can return to original Medicare and enroll in a Medicare supplemental plan with a standalone prescription plan. But I have noticed a change in the special enrollment periods that are happening throughout the year. So those are always going to be situation dependent. And sometimes you might hear things like, once you're in a plan, you can't make a change. You can always make a change. It just depends on what type of plan you're looking at and what you need to have covered. So the good news is Medicare might be a little tricky, but you're not alone. You have a great team of resources and people that are in your corner to kind of help you with those choices. One thing I cannot stress enough, if someone calls you on the phone and asks you for your Medicare number or says that they want to update your Medicare claim number, do not give them any information unless they come from a trusted, reliable source. Medicare is very much like the IRS, where they will not typically reach out to you over the phone. They will send more letters, but I've noticed between a lot of my clients that are a little bit older, they're getting all kinds of calls from everywhere, all points of time during the day, and they're asking to update their Medicare claim number. Typically, when this happens, it is a scam, and you do want to make sure that you protect yourself from that and keep that Medicare information close to you. Like I said, don't share unless it's a trusted, family member, friend, or agent that you are working with. So always be wary of those certain situations. When you are looking at what is needed to find the right plan for your needs, remember, health insurance is not one size fits all. So as you get close to thinking about retirement, or you're getting close to turning 65 and thinking about getting that timeline set for that Medicare maze and that big time comes, think about what you want to have access to in your plan. As you talk to family members and friends, you'll hear a lot of people say, oh, my plan is perfect for you. Well, you have to think about your individual situation. So think about those current doctors and hospitals that you want to have access to, and make sure that they are in your plan network if you are exploring a Medicare Advantage plan. You also want to think about your prescriptions, because that is something that you are taking every single day. You might not necessarily be going to the doctor every day or having an inpatient surgery, but you are going to take those medications on a daily basis. So make sure that those medications are covered, and that is a easy co-payment or co-insurance for you, that it doesn't cost too much. There's always ways to get assistance when you have prescriptions that you might need some help with. So patient assistance programs are really good. State programs are a really good resource for you to lower that cost as well. And then once you kind of decided on what doctors and hospitals you want to have access to and whether your prescriptions are covered, then you can think about your wish list or other health related needs. So things like dental, vision, over-the-counter, gym membership. You can easily find a plan that will fit your needs, and you have plenty of choices and plenty of timelines. But I cannot stress enough how important that initial enrollment period or turning 65 is. That's going to be the most important timeline for you. So as you kind of start that Medicare journey, just start thinking about some of those things that you want to see your plan have and what you want to have access to. As I mentioned earlier, FHK is licensed in over 33 different states. So we keep adding more and more states. I thought my home state of Wisconsin had a lot. Oh my goodness, some of the other states out there have so many plans as well. So I myself hold licensing rights in 20 different states. The doctors and the health facilities and the prescription coverage are always changing every single year. So you really do want to evaluate your Medicare options on that annual basis. And the other interesting thing is that Medicare plans are not the same throughout the US. So especially here in Wisconsin, we actually get to pick and choose what riders we want to have on a Medicare supplemental plan. Every other state pretty much has a letter plan. So keep an eye out for those choices as you are making that Medicare decision as well. FHK Insurance does work with a majority of the carriers out there, but of course it is going to be tied to your specific service area. So if you do work with a broker like myself or someone at FHK, you do want to make sure that we look up your zip code because not all plans are in every single zip code. So that is something that we'll want to take a look at. But I provide annual reviews, no cost at all. So I am happy to evaluate any insurance question or insurance plan that you might have as you are getting ready for Medicare. The nice thing is if you are in a plan that fits your needs and it works for you, I will be the first person to say, stay in that plan if it's working. Don't make any changes. But our agency is full of robust agents. Majority of us have over 25 years in the Medicare world. I myself only have 16 coming up in January, but I feel like I can pretty much answer any question when it comes to the Medicare world. And then, of course, you have some additional resources that are available for you. I can never stress enough that you can have access to all kinds of education because I think that's the biggest thing that you want to take a look at first is educating yourself on Medicare and how Medicare works. And there's a lot of resources out there. I know the Medicare and You handbook has just started making its way into mailboxes and in people's hands for 2025. So that will give you a nice overview of Part A, Part B, Part C, and Part D, and also the plans that are available in your specific area. Social Security is also a great resource to utilize. If you haven't already, be sure to create that ssa.gov account so that you can take a look at your benefits and see what you might be eligible for and also enrolling into Medicare. So a lot of things are being done online these days. And then every county will have an ADRC or an Aging and Disability Resource Center. They're going to be able to provide you with information that is relevant to the county that you're in and the different companies and really give you awesome advice. And then of course, if you want to call every single insurance carrier that's out there, you can do that too, but just be cautious when you do that because you're only going to get one set of benefits, but feel free to use it as a resource. And then of course, insurance consultants and brokers like myself, wealth of knowledge, providing all the information that you could possibly need when it comes to Medicare and the Medicare options that are out there. And I know that was a lot to handle in that 30-minute timeline, but any questions that pop up throughout the Medicare process, feel free to send me an email or give me a call. I am more than happy to help, and I am just a phone call or email away. And I managed to make it right to 7 o'clock, so I'm not going over my timeline. So I'll hang out for a bit in case there's any questions, but thanks again for having me, Nikki Johnson with FHK Insurance, your Medicare resource.
Nikki, thank you so much. This is Carla Zepnick. Thank you. You did an excellent job. And what I would recommend if you are on the webinar and you would like to ask Nikki a question, unmute yourself, or you can type in the chat and we can ask Nikki a question. She has a couple of minutes for questions here. Otherwise, you can also reach out to the advisor that invited you here this evening and ask a question to him. We'll get that to Nikki. Does anyone have any specific questions? No. Okay, we are going to close out, Nikki. Thank you so much.
Thank you.
You're always excellent. You got some accolades here on the chat.
Oh, thank you so much. I appreciate it.
Appreciation. So thank you, Nikki. We appreciate you.
Thank you.
All right, we are going to begin our next half of the session tonight with Nationwide brings us Terry Saby, who is one of our representatives here in the Wisconsin, Minnesota, and around the country area. And graciously, she went to bat for us and brought Roberta Eckert to us, who is a top national speaker in Nationwide, and we're so excited to have her. She's an expert in the Social Security area. And write down your questions. I know we already received a few questions in this area, Roberta. So if anyone does have questions, write them down or put them in the chat during the presentation. And then at the very end of the presentation, we'll ask Roberta to answer questions on Social Security. So Roberta Eckert, thank you for being here tonight.
Thank you, Carla, and thank you everybody for dialing in. Very much appreciate you taking some time out of your Monday night to do this. So we're going to just get to it. And Nikki, excellent presentation. I always learn so much about Medicare when I hear you present. So that's great. And you know, Medicare and Social Security really are intersected in a lot of ways. So this is a great follow-up, I think, to the Medicare presentation. So we at Nationwide have put together a presentation that we really like to deliver to you all, because what we have discovered is that there is a lot of misunderstanding around Social Security. In fact, we do a lot of research, and one thing that we found out was we asked a lot of individuals that they were 55 years old and older, and we said, listen, do you feel like you've got a pretty good handle on Social Security claiming? To be more specific, do you feel that you know all of the levers that you need to push in order to get the biggest benefit that you can? And 54% of the people said, oh yes, we know all about that. We have this, thank you very much. And we said, well, that's great, and we're glad that you know so much. Can you tell us what those levers are? And only 6% of the people were able to name them correctly. So sometimes people have a lot more confidence in their knowledge than actually exists. And we're here to really cut through a lot of that misunderstanding, as well as provide you with a tool that might help you when it comes to all of this. So a few things just very briefly as I deliver this presentation. I do want to let you know I've been in the financial services for over 30 years, but I'm not your financial advisor. That is what you want to leave up to the individual that invited you this evening. So I'm not going to be giving you tax advice or investment advice or legal advice. We're just here to go over some things about Social Security. And we've got some
Roberta,
yes,
if I can break up for a minute, your voice is going in and out, breaking up a little bit. I'm not sure why.
Okay. Don't know why that would be. Hang on. Okay, how's that?
You can give it a try. Hopefully it's better.
Okay. Yeah, I'm not sure why that is. Anyway, so we are going to actually talk about these three things in my 30 minutes and make sure that you've got some time to ask some questions as well. Well, I think everybody's probably pretty familiar with the idea that when you claim makes a big difference, and that if you claim early, I should say, then you are going to leave some money on the table versus if you wait. And the numbers, and these are numbers that we just used hypothetically. And by the way, Carla, is this a little better now?
I believe it is. I think speaking into the computer is probably maybe the trick, but thank you, Roberta.
Okay, sure. So in any event, there is a pretty big swing between claiming as early as you possibly can and then waiting until age 70. And in our example, it's a swing of, about 80%. And we always tell people we want you to be thinking about Social Security as your paycheck in retirement. And so I don't know how many people, while they're still working, would be okay leaving 80% or would be happy, probably quite a few, if we could find a way in which your paycheck could be increased by 80%. And it just takes a little bit of knowledge of the rules and maybe working with your financial professional in order to kind of work up a strategy. Well, let's take a look at a couple of these ideas first. First of all, a lot of people file as soon as they possibly can. And in fact, if you look back several years, what you're finding is that about half of the people that could filed before a magic age, which is known as full retirement age. We'll look at that a little bit more in depth very shortly. But again, you're looking at about half of eligible filers that are willingly leaving money on the table. And I think that the idea is they're not quite sure how much they're leaving on the table because they might not be working with someone that can really lay it on the line for them. So with that, I'm going to give you a quick example. And this again is one that we made up. And this example is a married couple named Pat and Kelly. They've been married to each other their whole adult life. And even that detail is relevant because what that means is that we don't have any what's known as auxiliary claiming options, things like spousal or survivor benefits or divorced people's benefits. So Pat is 66 years old, and if he waits until full retirement age to claim his benefit, he will start getting $2,600. Now, Kelly was a, if you will, typical stay-at-home mom. She stepped out of the workforce while her kids were little, stepped back in when they were going to school. And so her work record was not as robust and therefore didn't drive to as much of a Social Security benefit as Pat's. And so consequently, if she waits till her full retirement age, she'll start collecting a monthly check of $1,900. Now, if they claim as soon as possible, and what that means is that Pat can claim pretty much today because he's already reached the age at which he can claim. He's well over age 62. Kelly's not yet. She's got to wait another year. But if that's the case, then they will collect benefits over their joint life expectancy. That's something a lot of something people fail to take into consideration is not just looking at your benefit in a vacuum and maybe your spouse's benefit in a vacuum, but a joint life expectancy amount. And that number for Pat and Kelly is 1,456,572. Now, if they take advantage of the rules that are available to them and they can wait, in other words, Kelly might want to wait till 70 and Pat might want to wait till 70, well, then their benefits go up. And using the exact same life expectancy for the pair of them, it goes to $1,683,912. And that's a difference of over $200,000. That is a lot of money to leave on the table by just not understanding how the rules work. So one thing about understanding how the rules work is looking at situations beyond your own benefit. We'll touch on your own benefit as well. But we also want to go back a little bit and make sure you understand a little bit about the system. And these are where some people, areas where some people get a little sideways. First of all, Social Security provides you with a lifetime income that is guaranteed. That income can't go down, at least not now. I don't know, the politicians always talk about doing something with Social Security, but nothing ever seems to really happen. But who knows? It can't go down, at least as I'm saying this right now. Also, it is indexed to inflation. Now, this is pretty important because this is one of the few financial instruments that you have where you get an annual cost of living adjustment and you're not paying anything for it. So you want to think of this as like a free gift from the government. So that factor or the cost of living adjustment announcement is going to come out in several weeks. They don't anticipate it to be as big as it was 2 years ago, which was in excess of 8%. But you do get that cost of living adjustment. Now, one thing to be aware of is that you do not have to file to trigger the COLA. It is going to start getting added to your account when you are 62 years old, and it's going to keep getting added. So it's not like you must file or claim your benefit. in order to get that COLA activated. It will do it automatically. There are survivorship benefits. We'll talk about that more in a few moments. And one thing people don't always realize is that there's a little sliver of your Social Security benefit. It's 15%. There's a calculation that goes into this, but it's at least 15% that you can receive tax-free. So that's kind of compelling. You know, it's a little bit of a bonus, I guess. But when Social Security was created back in the 30s, it was called Old Age Survivors and Disability Insurance. And when you earn up to a certain level, beyond which you don't pay into Social Security anymore till the next year, you're going to see, pardon me, a line on your paycheck that is called OASDI, and that's what that is. And we encourage you often to take a look at your statement and make sure you're aware of the different elements that go into it. So, for example, on that left-hand page, you've got your amount that would be paid to you depending upon if you claimed at 62, 63, 64, and so on down the road. There's also an area that indicates what your survivors would be paid. And also on the right-hand side, it's going to tell you what your earnings were that your Social Security benefits were calculated on. And it's very important to make sure that you check that earnings year over year. Well, once a year anyway, but just make sure you do it annually, just to make sure that those earnings have been reported correctly, because you do not have an unlimited amount of time in order to correct an error. You want to do it pretty quickly so that you don't forget and that your benefit is miscalculated when you're ready to claim. The other thing that, hang on one sec, there we go, that I mentioned is a concept known as full retirement age. And more than 62% of boomers that we polled didn't know what this age was. Well, this age for your benefit is the age at which you will receive 100% of your eligible benefit, whether it's the benefit that is paid to you based on your own work, whether it's a benefit that you would receive as a spouse, as a divorced spouse, as a survivor, whatever benefit it is. Once you turn full retirement age, you are going to get 100% of that amount. Now, when you consider that more than 60% of boomers don't know what that age is, they're at risk of making decisions that might not be in their best interest financially. Notice that nobody has full retirement age of age 65. That was what it used to be back in the day. In fact, it synced up really nicely with Medicare. But now it is no longer 65. It's 66, or it's 67, or it falls somewhere in between those ages, depending upon the year that you were born. So if you were born in 1956, your full retirement age is 66 and 4 months. And then it goes up accordingly up until birth year of 1960, at which point everybody who was born in 1960 and later, and that encompasses, a lot of the population, their full retirement age is 67 years old. Now, when you put all of this together, at the risk of beating the dead horse, what you're looking at is someone that has a full retirement age of 67. And if their Social Security benefit were $1,000, well, they've hit full retirement age. They're going to get the whole thing. But if they claim early, there is going to be a reduction in that benefit. And for someone who's got this full retirement age of 67, it's 30%. So would be leaving 30% on the table. And that amount that is calculated into the reduction gets smaller and smaller as you approach full retirement age. Now, one thing to know, because we hear this with some degree of regularity, and that is once you hit full retirement age, let's imagine that you claimed at, say, age 63. And once you hit full retirement age, your benefit does not automatically revert up to this $1,000. Once you've claimed, you've locked in that reduction. And it is by and large permanent unless you change over to another benefit, say, as a spouse or a survivor. So just aging up does not get you any more money. However, if you can delay claiming past your own full retirement age, there is an 8% credit that gets attached to your benefit. And it stops at age 70. So don't wait past 70 because nothing will be gained by doing that. But if you can wait a year, 2 years, 3 years, however many years it is, even several months because it's a pro rata monthly amount, then it works out to be an 8% annual bonus. So you want to be talking to your advisor and seeing if waiting makes sense. For some people it does, for some people it doesn't. We're certainly not here to tell you what to do. That's really a conversation that you want to have with your advisor. And or the person that invited you to tonight's webinar, but in many cases, it's the same individual. Now, there are a lot of different rules, 2,400 rules, in fact, that go into the Social Security rule book. And we're going to just touch very briefly on the top ones, the ones that impact spouses, and then if you're a surviving spouse, or if you are divorced. But do know that there are rules for you if you're disabled. There are rules for disabled children. They're disabled for rules for government employees and children that are dependents of someone already claiming. Well, a few things about spousal. Before we get into this, I will tell you one or two things. One is that you can only claim one benefit at a time. Pardon me. You can't claim a spousal benefit and your own. It's either or. You can't stack them up. Well, let's talk about spousal benefits for just a moment or two. If I am married, and I have been married for at least 1 year, I might be able to claim a benefit based on my spouse's work record. And it could be that that benefit might be a bigger benefit than my own work record, in which case, obviously, I'd want to get the higher of the two. But my eligibility requirements are there on the left. To claim any benefit, you have to be at least 62. There are some exceptions to that rule, of course, but you have to be 62 by and large. You have to be married for at least a year, and your spouse must make their claim. You can't claim on the spouse until they have filed for their own benefit. And the amount that I would get is I'm going to look at my own or my spouse's primary insurance amount. Now, that's not a topic that I've touched yet. Primary insurance amount is the amount that one receives if they claim on the at their full retirement age. So let me go back real quick. If you see that 67 age where that first aqua bar hits, that is, of course, 67 being their full retirement age. That $1,000 is considered their primary insurance amount, and it can be ratcheted up or down depending upon when someone claimed. All right, so going back here, let's imagine that my spouse's primary insurance amount is $1,000. Then I would be eligible to receive $500. Well, let's say my spouse's amount primary insurance amount is $3,000. Well, then I'd be eligible to receive half, which is $1,500. And if my own Social Security benefit based on my work record is $1,000, well, it's foolish to claim $1,000 instead of $1,500. So in that situation, I'd go with the spousal benefit. Well, spouses also pass away and they get divorced. And so the surviving spousal benefit is also something that a lot of people ask us about. And basically, the eligibility requirements are there on the left. In this time, remember I said there are exceptions to every rule. You could claim benefits as early as age 60. You would still have that reduction applied, but you could do it. The other thing is, if I am widowed and I am claiming a benefit based on my deceased spouse and I remarry, if I remarry after age 60, I will still be eligible to get that widow's benefit coming in the door. I use that term very deliberately because more than 95% of that benefit is paid to women. Because statistically, we females outlive our spouses. So with that, how much do you get? Well, this time, instead of getting half of my spouse's primary insurance amount, this time I'd be eligible for, let's cut to the chase and say, I'd be eligible for whatever my spouse's check was. Not just the primary insurance amount cut in half, but the whole thing. Plus, I would be eligible if my spouse delayed claiming and therefore took advantage of those delayed retirement credits of 8%. I would be eligible for that as well. So the takeaway is that if my spouse is anticipated to predecease me and they were the primary breadwinner, it might make sense for them to hold off claiming because they are then accruing a larger Social Security check that would ultimately be my survivor benefit. Well, spouse get divorced also. And provided that you have been married for 10 years or longer and you are not married now, you would be eligible for the same benefits that you would be receiving if you were still married or if you were a surviving spouse. So, for example, if I have been married to my spouse for 10 years and we're divorced and I'm not now married, I could still get the same spousal benefit as if we were still married. My former spouse passes away, I would be eligible for the survivor benefit. It's called an ex-spousal survivor benefit. And it doesn't impact any benefit if my spouse remarries. I'm still getting the same check. And often we're asked if the former spouse knows that you're claiming on their work benefit. And the answer is no, not at all, not unless you tell them. So again, divorced spouses are eligible for pretty much the same amount of benefits as if you were still married, provided you meet those eligibility requirements. Well, I mentioned that there are 2,400 Social Security filing rules. And so at Nationwide, what we wanted to do was create a way in which you could cut through all of that chatter and find a method sitting down with your financial advisor that would be maybe the one that's most appropriate for you. So what we say is we're not going to tell you to take it early. We're not going to tell you to take it late, but we are going to tell you to take it seriously. So here's what the tool looks like. I've just created a couple of screenshots so that you can see what the report that will be provided to you includes. Now, a few things about this. Number one, it is provided at no cost to you. There is no obligation at all. You need not buy any Nationwide products in order to do this. It's a service we've provided it's a service that we provide with some of our key partners. And also it's confidential. We do not want to see your Social Security number. We do not want to see your statement. You would need it to fill out the form in order to get this report, but we don't want to see any of that stuff. So the one thing that I think is really nice is that they will create 4 different claiming options for you. And you can consult again with your financial advisor and figure out which might be the one that best suits your needs. They go from earliest claiming, that's the one there on the left, to optimal, which is the purple set of bars that is 3 from the left. And then there are a couple of there's an alternate, but there's also one that I kind of call the Goldilocks, neither too hot nor too cold. I don't say it's just right because that's not really true, but it's the one that says, look, we don't want to wait past full retirement age, but we're not interested in locking in a discount or a reduction either. So what's that look like? So we're providing all or 4 different filing strategies for you to discuss with your advisor. Now, all that's great, and it tells what ultimate benefits are over your anticipated life expectancy, but there's some more information that it's going to provide to you that I think is super helpful. Now, this little Morse code dots and dashes business, I'm going to translate for you. First of all, you're going to see at kind of the top a solid line kind of going from southwest to northeast. That represents the amount of income that you desire in retirement. You might need a little guidance for that. You know, people say you only need 80% of your income in retirement that you had when you were working. Well, you might want to consider healthcare costs. You might want to consider that every day's a weekend when you're retired. All kinds of things go into that. But nevertheless, you've got that solid line. That's your income need. And notice it's going upwards. It slants up because of cost of living. Underneath, for each one of those strategies we just looked at, there is a either dotted line, there is a green dashed line, there is a blue dashed line, or there's a small dotted line. Each one of those represents the income that is being derived from either of these 4 different strategies. So if you like the idea of purple, which is the optimal strategy, well, that dotted line, if you can see carefully, it is purple, and that's what's being reflected there in the report. Now, for most everybody, in fact, after doing this for about 12 years, I have yet to see, maybe once or twice, someone who does not have a gap between their Social Security benefit and the desired income that they have. So you want to be thinking about your income need as a bucket. And this is how much of that bucket that Social Security is filling up. So in this case, purple looks pretty good, but there might be some other reasons why you might not want to select purple. But you might be wondering, well, how much is purple exactly? Like, what's the amount of my gap? Is it $3,000 a month? Is it $6,000 a month? Like, what is it? And I don't, unfortunately, have a screenshot of that, but that is also reflected in your report as well. It's going to take this picture and look at it as a cash flow, year over year over year. And it will tell you in the first year, you have a desired income of $150,000. And out of that 150, here's how much is coming from Social Security. So your gap is X. And each year it's going to show exactly how that plays out. You'll notice in this case, for each one of those 4 strategies, the income level drops off. And you might ask yourself, well, what happened there? Roberta told me my income's not going to, my Social Security check can never get lower. Well, this is household income. This is a report that's being reflected on 2 individuals, their joint life expectancy. Now, what this means here when you see this drop off is that one of the spouses has passed away. So the surviving spouse, remember, you cannot take more than 1 Social Security check. So even though the surviving spouse has the option of stepping in to their deceased spouse's benefit, if it's higher than the one that they were receiving, they can't get those 2 Social Security checks any longer. And that's why you see that drop. Now, the way that you get this, pretty easy. In fact, we put in Dave and Carla's hands this questionnaire, but it's a pretty easy questionnaire. I mentioned earlier, we do not want to see your Social Security statement, nor do we want to see your Social Security number. But you should probably have your statement handy so that you can fill in some of this information with the most recent statement that you have. So your financial professional is going to fill out the first part there, their first name, their firm, and we are to send the report. We're going to send the report to them. They're going to review it with you. It's how our legal department wants us to do this. But then underneath that $sign where it starts to say about you, that's where you're going to get to work and spend maybe 10 minutes filling this out. And then you put it back in the hands of your financial professional. So it's going to ask you things like, what's your marital status? And you probably know why they're asking that, because they want to see, would you be eligible for survivor benefits? Would you be eligible for divorced spousal benefits? What if you had 3 former spouses that you were all married to for at least 10 years? You've divorced from all of them and you're not married anymore. Like, how does that work? Well, in that case, you would get the highest Social Security benefit or be eligible for out of the 3. So they want to make sure they understand all of the options that might be available to you. Life expectancy, planned retirement date, desired income, all those things are going to go onto the form. And then, as I said, you're going to put it in the hands of the individual that invited you to tonight's webinar. And then after maybe about a week, maybe less, they're going to get your report back. So in the time that I've had, I think a few things have become very evident. Number one, when you file and how you file is super important. Are you filing as a spouse? Are you filing under your own work record? Are you filing as a survivor? But also when you file. For some people, perfectly okay leaving some money on the table through a reduction in benefit because there might be some extenuating circumstances. How to claim benefits and understanding that your claiming decision shouldn't be made in a vacuum and that other people might be impacted by the decision that you make, particularly spouses and surviving spouses. And then I always love to ask people if they've ever worked a jigsaw puzzle. Most everybody has. And I love to think of your retirement income plan as a jigsaw puzzle. Social Security is a very, very important part of the puzzle, but it's not the only piece. There are various pieces that go in to creating a whole picture of your retirement. Things like a pension, things like personal savings, your own goals, what you want to be doing, maybe starting a business that costs money perhaps as well. So think about this within the context of your overall retirement income plan. So with that, I think I'm about at my 30 minutes. Carla, I'm going to turn it over to you to see what questions have come in. Thanks, everybody.
Okay, thanks. Thanks, Roberta. So I have a first question here. And if someone is 66 in 8 months, and they're wondering if they should start collecting Social Security, let's say July 24th of 2025, they're 66 and 8 months. Should they collect Social Security right when they retire, or should they wait till January 1st of 2026? I'm guessing this is more of a tax question. Because
if you notice me giving you this baffled look, July 24th is my birthday, so I thought, all right, Terry, who's calling in and like punking me here? So that would definitely be a situation where you might want to consult with your tax provider, and again, the financial professional. But as far as the nuts and bolts work, if you were born in 1958, your full retirement age is 66 and 8 months. So that would occur, if your birthday's in July, that would occur next March. Yeah. And not any longer receive any kind of discount, or pardon me, I should say reduction in your benefit. When to claim, it depends upon other income streams you have coming in. If you have a pension, maybe that you have selected to turn on at 65, there are a lot of things that go into that. So definitely want to consult with the other financial professionals in your life.
So that's basically a tax question, because I think you can definitely draw Social Security when you retire. Let's say you worked and you made $75,000. Halfway through the year you retire, you can take your full Social Security benefit from that moment on.
Oh yeah, sure.
It's just a tax question. I think he wants to know how much in taxes. So we do, ClearStep does have a tax program that we can plug information in to see the benefit of either waiting or getting your Social Security and paying the tax. So we have that ability to calculate that as well. And then there's another question.
Yeah, that's great.
Yep, there's another question, Roberta. His wife is on Social Security already, but gets very minimal amount. Will she get a raise up to 50% of what, when he takes his Social Security at full retirement age, can she then switch over to half of his?
Yes. And it would be, the starting point is half of his, or I should say the starting point is half of his primary insurance amount. So let me get a little deeper in the weeds here for just a moment. If my spouse waits till 70 to claim, they are going to get the primary insurance amount plus those 8% delayed retirement credits. Well, doesn't matter when he claims after full retirement age, I, as the spouse, am still only eligible for half of the primary insurance amount. So there's that. And if I am collecting my own benefit right now and my spouse has not yet filed, and then they do, provided I myself am full retirement age, then yes, I would receive half of that primary insurance amount. If I'm younger than my full retirement age, then they would start with half of the primary insurance amount and then reduce it somewhat based on how many years away from full retirement age I was. Is that clear as mud?
Yep. No. Yeah. So you're taking his full retirement age benefit because he's at full retirement age, and then just decreasing the percent per year based on her age. So she still gets lesser amount than 50%.
Yes. If she is claiming that spousal benefit before she herself is full retirement age.
Okay. And if she's at full retirement age, then she will get half of his.
Half of the primary insurance amount. Yep.
Okay. All right. Do we have any other questions? Unmute yourself if you have a question for Roberta. I have a question, Roberta. If you, can a spouse cannot take 50% of the primary of a primary person spouse until that primary starts drawing, correct?
Correct. There used to be a loophole, if you will, called file and suspend, and that was kind of a way around that. But that loophole was closed in the Bipartisan Budget Act of 2016. So it's been a while now that loophole got closed. But it used to be that someone would file in order to allow their spouse to claim, and then they would suspend their benefits. So, but yeah. No sense talking about what's not available anymore, I guess.
Yep, very good, Roberta.
Carla,
Yes.
my question also was, I was born in November 24th. So I'm gonna be 66 and 8 months, July of 24th of next year. So that I already have 6 months of income on my regular job when I'm gonna be able to collect Social Security at my full benefit.
Okay.
My question is, if I start collecting and still continue on working, what kind of penalty is there tax-wise on me? Sometimes I hear that it's for every $2 you make, you're gonna be paying an extra $1. I hear all kinds of stories.
Yep. So that's not a tax. So there would not be a penalty that is considered a tax penalty. If you are working and claiming your benefit before full retirement age, so both those boxes are checked. Number one, you're working. Number two, you're claiming your benefit before full retirement age. Yes, then there would be they call it an earnings test. And what they're going to do is withhold $1 for every $2 you make over a certain threshold. The threshold's about $49,000.
Yeah, I'm not gonna do that.
Okay, then
I'm
don't
gonna,
have.
I'm gonna go to the full. I'm gonna go to the full benefit.
Yeah.
That's why I'm saying in July of 24, I'll be 66 and 8 months. So I'll be there that full time. And then I continue on working. Then it doesn't matter. Then it's just as income. It's taxed at that.
The earnings test does not apply if you are working and full retirement age, correct?
And collecting Social Security from
Yes,
that point.
that's correct. Now that's different from any income tax liability that you would have.
Right.
But what
Okay.
you were referring to is something called the earnings test.
Oh, okay. So I thought, so I'd only be penalized if I took it before 66 and 8 months. As long as I take it after 66 and 8 months or at 66, 8 months, I can work as much as I want. It's just going to be taxed at a regular income bracket, whatever I'm in.
Exactly.
And the other question was with my wife being younger, she collects Social Security already, and say at my full retirement, 66, 8 months, she'll get a bump up to 50%, even though she's not 66 and 8 months. She's only 65.
So no, what would happen is because she probably is getting a reduction on her Social Security benefit that she's claiming right now because she's not yet full retirement age, right?
Right.
Yep. So when once she turns full retirement age, let me put it this way: once you start collecting, then she's eligible for a second or Social Security benefit, and that is the spousal benefit. Now, if she starts taking that and she is under full retirement age, then the starting point is half of your primary insurance amount, and they'll reduce it according to how far away she is from full retirement age.
Oh, okay. Okay. So she's gonna be 65. in March, when I retire, my full benefit of 66 and 8 months. So she'll get 50% of what I'm getting, even though she's not at full retirement.
Well, no, she'll get 50%. That the starting point is 50% of full retirement age. Sorry, primary insurance amount. But then,
Of mine.
but then because she's 65, so she's 2 years away from full retirement age, I think. Then,
Yes.
because I don't, yeah, okay. Then there would be a reduction applied.
Oh, so she will get less than the 50%.
Yes.
Okay,
But it
until
sounds-
she,
like- Go ahead,
what
Rudy.
was that? What was that?
I was going to say, it sounds like she'd still get an increase in benefit, based on the fact that she, maybe, I guess, it sounded that way anyway, from the way you were telling the story.
Yeah, yeah. No, I understand. I got it. Thank
Yeah,
you.
sounds like you do. Sure thing.
So remember with Social Security, when you are working and you're taking Social Security and you're beyond your full retirement age, which is usually 66 in some months, then just know 85% of your Social Security could be taxed, but it's an increasing. So if you're making a smaller amount, a less percent. If you're making a higher amount, then it's a greater percent. But again, we can do that calculation to see what percent of your Social Security would be taxed. That's one of the benefits that we offer at ClearStep Financial.
Okay, thank you.
Thanks, Rudy.
Mhm.
Okay, does anyone else have any questions for Roberta? All right, thank you all for being on the call tonight. Thank you, Roberta and Terry Saby as well, for bringing Roberta to us and bringing the expertise of this national speaker. Roberta, we greatly appreciate you.
Thank you. My pleasure.
Thank you so much. Everyone have a great night.
Thank you.